Transcatheter aortic valve replacement, or TAVR, is a minimally invasive procedure that treats severe aortic stenosis. This refers to an aortic valve that has narrowed or thickened, which makes it harder for your heart to pump blood to the rest of your body. The TAVR procedure implants a prosthetic valve made of pig or cow tissue to take over the work of your diseased valve. During a TAVR procedure, doctors use imaging techniques to identify a major artery, usually in the groin, neck, or upper chest. A tiny incision is made and a flexible tube called a catheter is inserted and threaded through your blood vessels to the diseased aortic valve. A doctor uses the catheter to position and deploy the new valve inside of your old valve. It immediately takes over your old valve's function and restores your normal blood flow. After doctors make sure the new valve is functioning normally, they remove the catheter and close a small incision with stitches.